Hi, my name is Lauren Cooper, and I will be doing my presentation on shoulder labral reconstruction surgery. So this procedure is primarily used to repair the torn muscle in your labrum and your shoulder. It is not a life or death procedure. It is just highly recommended if you've torn it, just because without it you will continue to have limited range of motion. It is very painful, and it can start to cause the issues in the surrounding muscles around your labrum, just due to the fact that your labrum muscle is much weaker and your other muscles are having to pick up the slack, and it just can cause a lot of wear and tear on those muscles. This procedure is often used on athletes. It is often most of the time athletes are the ones that are needing this procedure, and it is athletes that do repetitive overhead sports such as baseball, softball, and volleyball. As a softball player myself, I actually know about 5 people personally off the top of my head that have needed this procedure in the past year and a half or so. Give me 1 second. All right. So a little bit about the procedure. It is performed by an orthopedic surgeon in a hospital. Typically the patient will know their surgeon before the day of the surgery, just so they feel more comfortable going into the surgery. This is common just with all procedures, not just labral reconstruction surgery. And then some of the tools that are used during the procedure is an arthroscope, which is a small camera that they will put through the incision. That way they can just see a little bit better. And then some of the other typical surgical instruments that are used past the incision point, such as scalpels, forceps, and scissors. Some tips for the patient to prepare for surgery is: 1, you should not eat or drink past midnight the night before the surgery. And then it is also advised that any patients that take blood thinning medications, whether it's specifically for blood, like acts as a blood thinner, or anything just like aspirin, they are asked to stop taking those about 10 days before surgery, because if they are still on it, it can just cause complications once they're in surgery, and it can cause you to bleed out faster, etc. Another piece of advice was to organize your household items before surgery, so that way once you get home, it is easier to just do things with the other arm, that the one that you didn't just have operated on. It'll just make life a lot easier. And then another tip was to bring a large shirt for post-surgery. That way you don't have to pull anything over your head, or so that you don't have to wear the gown that you wore during surgery. Now for the procedure itself, the patient will be laid down on their side with the shoulder that's going to be performed on facing upwards, and then the anesthesiologist will put it'll be a nerve blocking thing in their shoulder, so that way it numbs everything and it'll stay numb for about 12 hours. This just prevents from any pain during the procedure or afterwards once they wake up. But the patient will be under anesthesia, so they don't have to worry about it during. But then afterwards, again, the patient will be administered anesthesia. And then once they're out, the surgeon will create about 3 to 4 incisions around the joint that allows the tools to work from several different angles. And then the surgeon will then put in the arthroscope, again, which is a small camera, through one of the incisions. That way they can see what's going on inside the muscle. And then the labrum muscle is then sewn back to the bone using suture anchors, which are screws. And then this suture will hold the labrum into socket until it fully heals. Then at the very end of the procedure, the incisions are sewn shut, and they will put dressing around the incisions, and then they will put you in a sling, and you will stay in the sling for as long as your surgeon instructs you to. It just varies depending on who the surgeon is or how in-depth the surgery was. Oh my gosh, okay. And then here's a picture of surgery. You see here's some tools. There's the arthroscope. Then there's some other tools going in there, etc. So some of the risks from the surgery, none that are particularly life-threatening, but there's a possibility of nerve damage, the wound getting infected, lots of shoulder stiffness, and then tearing the repair that they made, or just failure to repair the initial tear. The likely outcome is that it will be repaired, and then the patient will just have to do physical therapy post-surgery to strengthen the muscle again. For patient accounts, there is a lot of pain the first few weeks after the surgery, just because there's limited range of motion. You can't move the arm. I do know this because my best friend did get labral reconstruction surgery in October, so she's told me a lot about this. She said it did hurt, but it wasn't anything worse than the pain she was experiencing before the surgery, and then it has reduced as she has been through the recovery process, etc. But then one of the things is by going in microscopically, it does minimize the size of the incisions, and it doesn't force them to cut it and have to do it openly, and this allows the patient to recover quicker, and it reduces pain post-surgery. This procedure will definitely help someone gain a lot of their range of motion back. It reduces their pain, and then again, for athletes, it allows them to go back and play the sport that they were having at a much higher level than they were playing with the tear. All right, and then there's my works cited page.